Mental health issues, especially among young people, are on the rise. So how can Catholic education address this issue?
That's a very important question. It's a complex question, Brother Adrian, because there are a lot of different factors involved. I think that one of the mistakes that we make is that we have pathologized certain negative feelings. And so one of the reasons that that self-reporting of mental health issues and troubles and struggles, the reason why when people are surveyed, the numbers are coming back looking so dismal and so troubling, one of the reasons behind that, there are many reasons. We think about the effects of the pandemic and the isolation around that. We think about the effects of social media upon the brain, for instance, or we think about the divisions in the church or in our culture. You know, politics in the United States is strained. Politics in the Philippines have been strained for a long time. And so young people pick up upon the anxiety in the surrounding ambient culture, and it affects them deeply and can really cause them a lot of trouble. So those are all legitimate reasons why we're seeing an increase in mental health issues. But I think that there's another reason. I think that a lot of young people have somehow come to believe that there's something wrong with them just because they have feelings of sadness, or because they feel lost, or because they are troubled about their lives or about the world that they live in. And we say that that is a pathologizing of negative emotion. In other words, we're making a disease where there's not actually a disease. What I mean by that is God has made us with emotions, and we're meant to have, as believers, as Christians, and as human beings, we're meant to have a rich emotional life. And that includes happy feelings and sad feelings as well. And sad feelings are sometimes the appropriate and the truthful response to the life that we're living. When something difficult happens and we feel sad about it, that doesn't mean that there's something wrong with us. It means that there's something difficult that's come into our lives that we need to cope with and grapple with. And so I think we've sent a message to our young people that whenever they feel sad, there's something wrong with them. I don't believe that.